Recovery Reform is a podcast that provides educational content while addressing the stigma against drugs and the people who use them. Expertise meets lived experience as the hosts and their respective guests unpack the multifaceted cause that is recovery reform.
Welcome back to the Recovery Reform Podcast. I'm Taylor Nichols, and I'm here as always with my co-host, Macaulay Sexton. We are joined today by Jordan Scott, who is a person with lived experience with opioid use disorder and is a powerful harm reduction advocate and person who is actively using. And she initially sought her recovery from opioid use disorder through abstinence-based culture and has spent years sort of unpacking and unlearning that. And so she's here with us today to discuss that journey. Jordan, welcome. Thank you so much for coming on.
Hey y'all, thank y'all for having me. I was glad, I said the planets aligned and we were able to make it work.
Yes, I was very appreciative of you sort of hopping on with us. Tell us a little bit about, walk us back in terms of your journey, in terms of when you sort of started using and then how you ended up arriving to this place where you feel now comfortable acknowledging you're a person who uses drugs.
Yeah. Okay, so it's like the Cliff Notes version. So if you had a recipe, if you take a little bit of religious trauma, a little bit of generational trauma, a little bit of just being an elder millennial and that kind of culture that we, grew up in, that just culminated in kind of everything kicking off, when I was, I think around 11, 12, when my mental health stuff started. I know now that I was autistic, undiagnosed, also had, ADHD. And that was when I started having suicidal thoughts, and I was engaging in self-harm. A kid dealing with just a lot of stuff, really chaotic family life, all so much going on, and having these really big emotions, not knowing what they were, not knowing what to do with them. Self-harm came into play, suicidal thoughts. I had my first suicide attempt when I was 14. That was my first time going into an institution, and that just kicked off the cycle. And I spent the next, I don't even know how many years, just cycling in and out of institutions, sometimes being involuntarily committed, other times, seeking help voluntarily. There wasn't always a primary, I can't say my primary issue was drug use or my primary issue was mental health. It was just this kind of clusterfuck of just all sorts of things, and largely being just not being able to access help, whether I needed, detox, or I needed to be inpatient or outpatient. And even when I could access stuff, it wasn't quality care. I am a survivor of institutional trauma. I am somebody who was, sexually assaulted when I was in a facility by staff. I've also, survived years of medical trauma, because when you are a person who uses drugs, the healthcare system does not treat us kindly at all. And then, I found recovery by the means that a lot of people do, in the basement of a church, abstinence-based. And I wasn't new to abstinence-based recovery. I think I had gone to my first 12-step meeting when I was 14, my first time when I got put into the psychiatric hospital. And I had kind of gone on and off throughout the years, but this last go around, I was you know what, let me just give this, a good faith effort. And if it doesn't work, I'll just go back to what I've been doing. And so I did that for a little over 8 years. Fully immersed myself into abstinence-based recovery and did all the things that they told me to do. And my life did get better, but things just aren't that simple. And, like I said, earlier, I'm disabled. I have several chronic health conditions that, cause chronic pain. and got to a point where, like, so yes, I was sober, I was abstinent, but I also wanted to die every day. And I was like, this can't be what I went through all of this stuff for.
I think something that you just said, a phrase that you said is, it's not that simple, right? Like the idea, and this was something you mentioned right before we came on, is that abstinence is a privilege for some. And not everybody has the luxury of simply being able to be completely abstinent from the things that they would want to be, because they need substances for treatment. And I think some of the things that you mentioned that are really interesting to me are sort of the timing that you're describing using, and that obviously you found something, and in that it was opioids. It sounds like other things as well, but opioids were the thing that you used primarily, that sort of called you, and that you found some reprieve from what you were suffering from in that, right? And it's why I think of substance use disorders in the context of behavioral disorders as like learned developmental problems. They're not, it's not necessarily like a chronic disease,
Right.
but it is a developmental in the sense that as you're developing and you're trying to cope with all of these different and difficult things that you were describing, you find something that gives you what you need. It's the dopamine, it's the euphoria, it's the escape, whatever it is. It's the emotional coping tool. And developmentally, you latch onto that, right? That is what gave you the thing that you needed, that you gained something from it. And then you're in a place where you have actual chronic conditions that are causing you harm, and you need substances to be able to escape that harm. And so where did that then lead you in the idea of sort of unpacking this abstinence-based culture, which as you said, like you acknowledged, it improved your life, it helped you. Mm-hmm. But then you unpack that, and where did that lead you? And how did you do it?
Okay. So I think even the whole like 8 years that I was in abstinence like based recovery, I never felt 100% a part of. Because also like, I'm a recovering perfectionist. So like I need to be perfect in every aspect of my life. But so beyond like my quality of life issues, like because of my health conditions, and not just like, the physical health conditions, but, so like I've dealt with, chronic suicidal ideation since I was 12, I'm 38, about to be 39. When it really started, I was working in residential treatment. I was the admissions tech, and I worked Monday through Friday. And mind you, like when I first got into recovery this go around, that was like right at like the peak of, the quote unquote opioid epidemic, right? And the pain mills and all that stuff. But I was working in treatment, and I left work on a Friday. When I came back Monday morning, 6 people who had all left our treatment center within the last month had overdosed and died in the same weekend. And like loss itself isn't new to me, because I think the last time I tried to count how many actual, people that I personally know who have died from an overdose, like I got to like 50 and I stopped counting. And like that wasn't all of them. I lost my first friend to drugs when I was 16. But there was something clicked in that moment, because I was just like, this isn't okay. Like, and I think especially those of us like with lived and living experience, and when you work in the field, we do become desensitized to death. I remember like just like looking around the staff office and just getting this vibe that like it was just another Monday, and I'm like, this isn't okay. And that was like when I started like learning about harm reduction. Um, and all I kind of knew in that moment was I like, it wasn't okay. Like, obviously, what we were doing wasn't working, but there has to be something out there that does work. And I just, like, went to Google and just started Googling. God, if anybody, like, if the government is tracking my Google search history, I am absolutely on multiple watch lists. But I just dove in, and like, I've always been a learner. Like, I could read by the time like I was, 4. Always loved reading and learning, and so I just dove in, and I started with, a big one, overdose prevention centers, because to me, that was the hardest concept for me to wrap my mind around, because it was the antithesis of everything that I had been taught. And, I was really lucky that when I started that journey, I got to learn from people like Mark Kinsley and Dan Bay. And I just kept learning, but like, I would say unlearning, but like, unlearning is messy. Like, it is really messy. And that's where we do a really bad job, is like, we don't support people in their journey of unlearning. And that, like, we lose people to like the self-righteous anger. Um, and, so between like that and then my health issues progressing and, waking up every day and wanting to die and being like, again, like, this isn't okay. But it was also terrifying at the thought of losing my community. But then the pandemic happened, and it created this like separation, and I started expanding outside of my like Southeast Pennsylvania bubble and meeting people around the country, and actually meeting people who identified as being in recovery and also somebody who uses drugs. And that was a mindfuck. But it's easy to deny something if there isn't a personal connection, but then once there is personal connection, like, it's not so easy to deny its existence anymore, if that makes sense.
Yeah. Yeah, no, it makes complete sense. And I had the exact same experience as you, like to the T, and the timeline is the same as well, apparently. Um, just like exactly the same. And like quarantine enabled me to kind of deep dive and honestly, I became a hermit. I was like, I needed to kind of isolate for my own well-being and mental health, which is also like almost never talked about. That isolation isn't always this negative thing to where someone is like harming themselves. There's when you're exposed to a lot of overstimulating community for a long time, and institutional trauma and trauma within treatment and just trauma within reality, sometimes we need a little bit of time to kind of like center ourselves and to evaluate what we've just been hit with. And for years, if you're someone with a substance use disorder, you're going to be hit with like the same stuff over and over and over again. And then when you're faced with something that's different or conflicting, it's so intimidating. And quite frankly, I can just speak for myself. Like, my ego was like, no, I can't be wrong about everything. Like, how am I wrong about everything? This is wild. I devoted my life to this. And yeah, I mean, I had the same experience as well with, for me, I just wanted to isolate, and I was having that, it could be labeled as like ideation, but it was this like idea of just being able to be like suspended in space, like by myself or something, like just completely just void of existence. Like, and then, so that was definitely something that I experienced as well throughout the end of my 12-step journey, is just being like, wow, like I'm abstinent. I'm like extremely abstinent. But I am not doing too well when it comes to like just my just kind of being just as a human. It was just like, this is exhausting, when you're devoting your life to service work and inventory and constantly kind of searching for resentments and stuff like that. And there are just so many things that you shared that seem to be pretty universal when it comes to people kind of shifting to this place of like unlearning, and there's this pivotal part to where everyone that I've talked to has become aware that it's not, the current approach is not working. And at that point, you have a decision to make. You can either unlearn and change, or you can remain complicit. And it's scary when you're told that you're going to die if you leave. So it's fundamentally systemically set up to prevent people from doing that, thus kind of preventing any sort of real cultural change or systemic change, you know? And so I have so much respect for you and everything that you've shared today, because it was making me very emotional. And I often you know, am kind of desensitized to people's like stories, because I've just kind of heard the same one over and over again in the 12-step context. And so it's just very, very refreshing to hear your experience. And yeah, just like, I really appreciate it. And I was hesitant to even do the whole matching of experience thing, because I just find that so like tone deaf a lot of times, you know, but we're on a podcast. So I was like, I should probably say this, you know, because it's very relevant.
It's more common than people think, you know. And one, like, I just want to go back to like your comment of like, you know, like that the isolation that you sought out and craved during the pandemic. Like, dude, like disassociation is a top tier coping skill. Because like I have a brain that it's often necessary for me to completely disassociate. Otherwise, like shit's gonna go left really quick. And that, I feel like that's a concept that people, if you don't have direct experience, is hard to understand, right? Because I was also taught for years that like seeking out escape was a bad thing. Like, well, no, because the context matters, right? Like coping skills aren't inherently bad, just like drug use isn't inherently bad. It's all like, it's the context, it's the intention, it's the setting. Like, you know, my drug use isn't like all willy-nilly, you know, like there's a method to the madness. But I also look at, especially because, you know, like my work, I primarily work, you know, in peer support. And I know so many other people who like share again, like that same experience that you and I had, but it's either not safe for them to be outspoken about it because they will, you know, lose their job, lose their community.
Yeah.
Or they're, you know, on that unlearning journey, but they don't have anybody supporting them and they're kind of just like lost. Because I also like, I felt lost for a while because my identity had been wrapped up in this program for so long. And all of a sudden it was like, well, who am I?
Yeah.
It's interesting hearing sort of both of your sort of coincident journeys in this. And Macaulay, I knew that this would resonate for you too. But one of the things, Jordan, that I wanted to go back to is you talked about sort of the what we call like set and setting in terms of drug use.
Yeah.
And you're in the context, and right, that it's like that matters what your intention are, what your use is for, and how you're managing that. And if you find it problematic or not. And so walk me through that a little bit. Like when you say that, what does that mean? To you, what does that look like for you?
So I think what I finally understood, because I would say like the bulk of my unlearning journey happened from like 2019 to like 2023. And what I kind of realized at the end of it was I just needed to listen to my body. You know, I don't have a specific pathway because like my body changes every day. You know, some days it's, you know, my pain that is, you know, taking center stage. And so that's what I address. And other days it's my mental health. So whether that's using cannabis or psychedelics like, you know, ketamine and MDMA, or also like contrary to some people's beliefs, like I do have coping skills that aren't drugs. Like I've got a whole Mary Poppins bag. So it's not like, oh, every time I feel something, go through something, oh, let me dig in my druggie bag and find something. You know, sometimes it's I take my dog for a walk, or I just end my day early and go for a drive. But there's times where I have turned to a substance and that kept me from going and dropping, $300 at Target, which can also be very detrimental to my bank account.
Well, I think that's an important thing to talk about, though, right? Because of this same idea of like it's developmental, it's a behavioral disorder of using that as a coping skill, just like any other coping skill, and it's about moderating that and finding your coping skills that work for you, and that can include using drugs, right? And that if it's in a moderated way that you feel like you can control and that sort of in the right context, if it works for you, then that's great. And it's so important to be able to sort of walk yourself to that place. And I think it's pretty remarkable that you did. In the same way that, like, when I first talked to Macaulay, like that, the fact that clicked for me, that resonated, because
Yeah.
it is hard to do absent being in the space where that's like actively being discussed. Or like for me, I was already an emergency physician and I was already seeing the harms of substance use, but recognizing that I was in a system that was causing harm, and then on my own journey of unlearning from that perspective, and then working to get board certified in addiction medicine. And so I was doing the work because of the context that I was in, but I was not in the space of like, oh, part of my identity is wrapped up in a 12-step abstinence-based program, right? So it's hard to step away from yourself like that and look to something completely different. And there's a little bit of like an ego death, and that part is really hard. And I think that's one of the hardest things for people to manage, right? Especially when you've been in a place, and like Jordan, like you've acknowledged, and Macaulay, you as well, like this benefited me. It was something that helped me for a time, and then it was still harming me. It was still holding back from sort of recognizing that there were more options available than this one sort of very dogmatic, restrictive process of maintaining this. And so yeah, go ahead.
I was gonna say, I think we forget that if we actually look at the diagnosis in the DSM-5, and I am qualified to talk about this because I did community-based and prison level of care assessments for 5 years, but there is an in remission.
Yes.
And we also have mild and moderate, but we only ever talk about severe, and like you said, I think it also gets compounded, especially like if you are working in a field that puts you into daily direct contact with primarily people that are engaged in severe, chaotic drug use. It
What kind of gives you
it puts you in a bubble.
Yeah, it gives you a little bit of like a skewed perspective in that way as well. And it's funny that you bring that up, because I think Macaulay probably has heard me rant about this maybe too many times, but I always talk about how like there's the medicalization part. And yes, when I work with patients, I explain to them like my goal is to help you obtain remission, if that's your goal. My job isn't the recovery part. Like I see remission and recovery as completely separate. Recovery is the active, or the act of, or to use it as an active verb, like the act of recovering the things that you lost in the process of your chaotic use. And that doesn't have anything to do with being in remission necessarily. You can recover those things and still be actively using, just in a more moderated, controlled way, right? So it's not that like remission in and of itself is recovery, and the opposite is true as well. Like you don't have to be in remission to recover. So I think it's interesting that you bring that up, because it's such a important point, and from the like medical side is something that people don't really, I think, necessarily, well, one, don't talk about. I think part of that is because I don't think people understand that idea, because people haven't unpacked that enough to think that remission or abstinence has anything to do, or they think that it has everything to do with their recovery. They don't think that it has anything to do with like separating the medical side and sort of the recovery and the mental health journey that you've been on, and all of that, right? So it is true that like when you look at it from this one isolated lens, that becomes problematic, and that yes, from the medical perspective, remission is the only fact that medicine has anything to do with. Recovery is very much individual, and everybody's recovery journey is different. And that's again like why we named the podcast what we did, is because like we want to reform the concept of recovery. We want to like take that back, because it's so right now it's so tied into this sort of dogmatic abstinence-based understanding that is so flawed and is so harmful to people, including the people who do benefit from being in that abstinence-based culture initially. But that's not the only option. And I tell people all the time to like seek out the option that fits with them, that resonates with them, and that they can find long-term sustainable recovery for themselves.
I think it's like anything that exists on a spectrum, like in general, our society cannot wrap their mind around. Because like I see it, on LinkedIn. Macaulay, I've seen on your TikTok videos. Like if you dare express an experience that is different from somebody else, like the amount of people who take that as this very personal attack, or like I love when I get comments of, well, not everybody can use drugs in moderation. And I respond with, I want you to pull up where I ever said that. Because the thing is, like, even if like I, wasn't, a harm reductionist, like what I have learned as being autistic is my brain does not operate in blanket statements or black and white statements. Like that makes me short circuit, because I'm like, well, but what about this? And what about that? And what about this? Like, because again, like it's not that simple.
Yeah. I think that it's really hard when I have like empathy towards that, that kind of grasping that goes on when you're faced with something that is completely conflicting, and that can cause like legitimate cognitive dissonance, where you're just like, what is going on here? It's a hard pill to swallow, pun intended. And so it's like, I definitely think that I'm someone who is also on the spectrum. And then when we, look into like what you were just referencing, like the concept of spectrums as a whole, I think a lot of people these days that may be leaning in a certain kind of like political direction are very triggered by the word spectrum, first of all. So like as soon as you say the word spectrum, they associate it with gender identity. So so there's a lot of stuff going on now.
And communism. So.
Yeah. 100%. And so a lot of my cause and a lot of my colleagues and my peers and everyone around is like, as I'm sure it is with you, kind of being mindful with language and stuff like that. And so then that's being like kind of lumped in with specifically advocacy for the LGBTQIA plus community, which is also part of the cause for me. But it's like that people get triggered by, and then they start just shitting on, all of these concepts that come down to human rights. And like ultimately this is a human rights issue is what I'm trying to kind of segue into. And, just kind of like tying it back into everything that you've shared, like you've perfectly articulated how like basically needs are not being met at all. Not only are needs not being met, but like abuse, SA, other forms of trauma are being perpetuated within these resources. And instead of kind of like calling people up and saying, hey, like, let's validate these things. Let's platform you. Let's share these things. Let's get these things out there. It's more so of like, no, you need to just like ultimately take responsibility, which for those of us who have spent time in 12-step, if you're in there long enough, you're probably going to take responsibility, and you're probably going to take responsibility for things that are not your responsibility. And I think a lot of this process for many people, and kind of what I heard you articulating, maybe not directly, but this is what I was interpreting, is that like a lot of this is about like validating things that you don't have a part in, and validating things that are out of your control. And that process is not really presented really to anyone. It's like the opposite. And I think that you can do so without fostering what some people would call as like a victim mentality. It's like, no, like, acknowledge if you've been victimized. Like, you can acknowledge that and still maybe not be in a place of like what 12 steppers would say is like self-pity or terminal uniqueness. Like, you can acknowledge all of these things and simultaneously be accountable and call for the reform of these things. And I just think that like everything that you said just like very perfectly kind of laid that out for me. Maybe I just have a weird interpretation, but in closing, I'll say the other thing that I really just want to reiterate is like when someone who has a past substance use disorder shares that they are able to engage in substance use in a different way, that means that it's in a way that's sustainable for them based on their intuition. And this is very intuitive. It's like intuitive consumption or intuitive eating. It's literally, for many people, that's what it is. And when you've been disempowered and told that you don't have the ability to do that, that is usually what makes it almost impossible for people. It's because that they fundamentally believe that they can't do it, and they're told that if they try, that they're going to die or they're going to end up in jails, institutions, and so forth. So I just wanted to kind of reiterate that every single individual that I know that has a past substance use disorder and then is able to engage in substance use in a way that's sustainable for them, they not only are doing so from a place of intuition, but they're also respecting their past experiences. I've never heard any denial of past experience. And that is something that is often projected, is there's this idea that the only way you can engage in substances is if you just deny all of the negative consequences that you had in the past with them. And it's the exact opposite. It is in constant respect of that. And that is why people are able to moderate, because they're respecting that, and they're bringing about this practice that is an acknowledgement of that, And I believe that every single person gets to decide if that's right for them or not. And I also understand why it's being put out there that it's not possible. It's because people have been taught that they need to be paternalistic, and it's from a place of like wanting the best for people, but it's also projecting what you think the best is, So yeah, I'll wrap it up because I said I would like 5 minutes ago, but
You perfectly touched on like so much of what like my like outside consulting work around like messaging and storytelling focuses on. Like in that process of the journey of unlearning, at some point everybody gets to what I call the messy middle. And for me, like that was the true moment of reckoning. And for me, that happened in like 2021. And that was when it finally sunk in that, so I lost my brother to an overdose February 2013. And I had like just gotten sober, right, leading up to that. And he was engaged in use. Our last few interactions, I was not kind. In the moment, I thought I was doing the right thing because that's what I had been taught. He's going to get you high before you get him clean. You have to, love him from a distance. So I thought I was, giving tough love. I was not kind. And the reality was I abandoned him. And that was a very hard pill for me to swallow. Because then with that also came that, the women that I had sponsored, clients that I had given advice to when I worked in treatment. I didn't do right by them. I gave a lot of people really bad advice. But I didn't know what I didn't know. We lose people when they get to the messy middle. Because that moment of reckoning, it hurts and it's really painful. But if we get to the other side, like that's the magic. And so I want to just help people get through the messy middle to the side of magic. Because like when I got to the other side, that's what's allowed me to truly just show up in life without expectations and to just be present with the people in my life, really fully respect people's autonomy, and just love. And I can't go back and change anything, but what I can do is make a commitment that I'm going to be for other people what I couldn't be for my brother and what I couldn't be for those clients and those women that I sponsor. Like, that's my living amends.
Yeah, that's very real. I mean, that's my journey as well. I think back to what I had been taught and like how you're supposed to quote unquote help people, and you know, there are people who are dead today because they were not offered just love, basically. You know, that's, you can be with people without offering a solution too. It's totally okay to sit with people and let them talk and not have to fix it, you know? And yeah, it's something that definitely gets me very emotional. And I think that you know, I have people in my life that I started off with that approach, and then luckily during, you know, just the timing of everything, I was able to stop doing that. And there's some people who aren't alive because they fucking died while I was in that approach. So I feel you 100%. It's something that I think anyone within, you know, 12 step that, you know, has empathy and is like actually engaging in like an actual spiritual practice would probably really want to not harm people. And so that's often kind of the one of the approaches I take when having discourse. If I'm not just choosing to be petty and condescending, I will go into this like, hey dude, like you seem like you really care about people genuinely, so let's just be there and offer unconditional support. And I think, you know, that doesn't mean you can't have boundaries. You can have boundaries and support people unconditionally. And, you know, in conclusion, I'll just say that we can ask people what they want.
Mm-hmm.
We can totally ask people what they want. And, you know, that's like kind of unheard of.
I think what you both shared is incredibly powerful and both tragic and powerful. And I think that, Macaulay, what you just said is exactly like the answer, right? You have a bunch of people who are trying, presumably, to come from a place of empathy to help people who have their own history of having lived experience, and they want to support other people through that journey in their recovery their way. And the problem is that, you know, Macaulay, you've said this 1,000 times, of like the lived experience fallacy that is like platformed in some of these sort of recovery spaces where it's put on a pedestal. You're, you know, in terms of how long you've been abstinent and your recovery process, and that is sort of elevated. And so you see this model that's built up of like, oh, well, the way to do the best to support the most people is to continue to be abstinent and tell others to do that too, without recognizing that that's causing harm. And I think when people's eyes are open to the fact that that system causes harm, if they're coming from a place of empathy, Macaulay, just like you're talking about, in terms of like deprogramming of like, let's just sit with people and understand what they want and how they want to be helped, not how you want to help them. That's centering you, not the person who is actively used. And let's find out what their goals are and what they want their recovery to look like, and then lead from that, rather than saying, I know the answer, this is the only way, and I'm going to make you get there. It's a paradigm that is so true in medicine too. And we've talked about the idea of paternalism being the problem here, right? Being the problem in a 12-step abstinence-based sort of culture and in medicine, right? The problem with medicine causing harm and the healthcare system causing harm, and the problems with the healthcare system go far beyond medicine in the US, that, right? For me, it was a recognition of the system I am in is causing harm, just like for both of you, it was like the system I'm in is causing harm from the recovery side. And for me, I was like, we are forcing people to be harmed right? If we aren't harming them directly, which we are, even just by stigmatizing them and shaming them more, which is not only not like helpful or productive, but is particularly counterproductive in the patient population we're talking about here, is like we're forcing them back to an unsafe drug supply. We are forcing them back without giving them actual help, without acknowledging what their needs and what their goals are and how they want to proceed. And so I make that a priority with all the patients that I work with, is like ask them their goals for everything that they use. And it's like, I can help you get there. And it may not be abstinence. That's fine. But I'll work with them. And it's such a paradigm shift. And it's the same as true in recovery spaces. But it actually it has made me enjoy what I do so much more, to have flipped that idea on its head and be like, I'm not going to tell you what you need to do. I'm going to tell you how to best support you after you tell me what you want me to do, right? If you tell me I want this help, I can help you with it. If you tell me I don't want your help on this other thing, great. It's not my responsibility. I'm not here to tell you the only way you can accomplish that goal, but I want to help support you in getting there. And it makes me so much happier doing that and knowing that I'm actually giving people what they need, and I'm actually supporting people in accomplishing those goals, and I have better outcomes because of it. Whereas when you're in sort of the paternalistic frame of mind, then you're like, well, why aren't people doing this? And it's like, well, I'll tell you why they're not doing it, because you never asked them how you could, like, you never were on a team with them. You got to be on the same team if you want to get to the same place, right? And so there's no alignment when you come from a paternalistic standpoint. And if you're coming from this, pedestal-based abstinence, time and abstinence only framework, it is by its nature paternalistic. And you cannot accomplish your goals if you come from a place of paternalism only. And so I think that's the thing that, and not that I am unique in recognizing this, Macaulay, you talk about it all the time, is like, that is the common problem. Well, I'm
like, you just almost made me cry, because like even if you couldn't solve that person's problem in the moment, I can guarantee you that every single person you have interacted with as a doctor, you gave them a positive experience. And as somebody who, like, institutional and medical trauma, like, it's doctors like you that give me faith in our healthcare system, because I now have a doctor just like you. And because of the way she's interacted with me, it's made me want to actually schedule my specialist appointment and get testing done that I need to, because it's easier to remember that, like, the whole system isn't fucked. Like, there are good people working within shitty systems that are trying to do something different. I made a really unlikely LinkedIn bestie like a year ago. He's this older white dude. He just like popped in my DMs, and at first I was like, here we go again. But he messaged me and he's like, I hope this isn't intruding. He's like, but I saw one of your posts, and I had ended this post with, I'm tired of paying the consequences of other people's good intentions. And he's like, I don't know why that sentence is bothering me so much. And I just said, okay, like, do you want to jump on a call? And he said, yeah, and we changed numbers. And we just had this series of amazing conversations. We still keep in touch. He's my LinkedIn bestie. So like, I think because we very rarely get to see like the immediate impact of our actions and the things that we say. So like, I hold on to that, and I'm like, I am impacting people, and I am giving other people some comfort and some courage. And like, to me, that's the most important part. So like, you are unique, because I mean, I look forward to when we do have a system where people like us are not unique.
Yeah. Yeah, 100%. I think that within any of these systems, whether we're talking about, let's say even 12 step, we're talking about the medical space, we're talking about, people who are into like neurobiology or that are geneticists or whatever, like, what's going to make them, like really just good, in my opinion, is that they move outside of the bounds of their indoctrination, because everyone's indoctrinated into something. I'm indoctrinated into like radical autonomy and like other concepts. But like the point is like that is what like humanity and like unique manifestations of humanity is like what, in my opinion, makes like human interaction go around. Like that is what like facilitates actual like solid communication and like real empathy and like just empathetic engagement with other people. And so yeah, I mean, that means a lot when you're repeatedly exposed to the same stuff over and over again, and it's like you're just like talking to a wall. And so it's like I've talked to Taylor about this before. I mean, I have tons of medical trauma as well, and being someone who suffered a traumatic injury at a very young age and had a near death experience, and the experience that I had after dealing with doctors was like not really good, and the ones that were good, they really stood out to me. But why did they stand out? Well, they stood out because people were like engaging in their humanity, and they weren't they weren't like doing anything else other than that. And so that is why I was even willing to do this podcast with Taylor because dude, I have actually have a lot of beef with the addiction medicine in general and the way that it's often practiced because of the heavy 12-step influence, And so I think like that's something that I think is important to acknowledge, and like how this podcast was even formed is it's like actually being able to bridge the gap between the medical space and the more like anecdotal lived experience place, and and then bring in people who defy the dogma that's been presented, and it's like you just so perfectly done that for us today. And I just like I really genuinely appreciate it, because it's you're so eloquently and perfectly articulating the kind of the order in which this often plays out for people.
Yeah.
And I'm sure there are people who can kind of experience it differently, but I don't want to like present some dogmatic view of deprogramming or whatever, but like I think that it can really bring about genuine realistic optimism for people, not this like kind of delusional, what I would call like hope based thing where it's all just like we'll just hope and hope. It's like no, like there's actually a way to go about this, and we have actual philosophies and principles that are already established by people way before us that we can then bring in and integrate, because that's what showed up for me. And that's what I heard you say, is that when I went through this process, I was like, wait, hold on, so I actually believe that people should have complete autonomy. Well, what does that mean? Well, that actually means that people could harm themselves. Oh no, but I don't want people to harm themselves. Well, guess what? There's something called harm reduction. And so, whoa, shit, it actually is a perfect fit. Oh,
Right.
and there's risk reduction tools. And so I say this to people who are conflicted when they hear these topics and what we're talking about. We have a solution that, when implemented effectively, will reverse overdoses, will prevent the spread of bloodborne illness, will, show like be there for people. And so we're not just advocating for this like complete chaotic, like, oh, everyone just dies now. Like that's what people interpret.
Harm reduction does actually include consequences, because consequences are just unavoidable in life in general. It's like if it was possible to be perfect, you could be a perfect human being and still get hit by a bus one day. Or I mean, like anything, right? Like
Well, and I think it's so important to acknowledge that that's what people struggle with. That because we exist in a society that is so uncomfortable with that is so uncomfortable with the idea of embracing this radical autonomy. And when applying that to something that people see as having really negative consequences individually interpersonally and socially, they're like, oh no, we couldn't possibly let people use drugs. But all of that goes back to, like over a century ago, right? When we started litigating drug use, right? Like back in, I mean, I could go dive into the like nerdy legal history of like with the Harrison Narcotics Tax Act in 1914 and all of that, right? And then Just Say No and Nixon and Reagan and scheduling of drugs and moralizing them.
I actually gave this speech at my DARE graduation. Just throw that fun fact in there. Thank
That's
you.
amazing. That is amazing. But it's this part that we're stuck on as a society, in which we've moralized drugs and therefore the use of those drugs, and then have difficulty embracing. Like, we can embrace humanity in so many other aspects of life, and this is one where we just can't. People cannot wrap their head around the idea of just letting people use something that they view as morally wrong, right? They're like, well, you couldn't let somebody just go out and murder a bunch of people because that's morally wrong. And you're like, well, okay, murdering people is not the same as drugs, right? So like, let's acknowledge that there's a contextual difference here. So it's not that we're talking about like some like lawless, consequence-free utopia. That's not what it is. And Jordan, like you mentioned, like consequences still exist. And part of acknowledging people's autonomy is acknowledging that those consequences do exist and can and will still exist for them, but also embracing that people can make decisions that may still have consequences. And we don't regulate those in so many other aspects of life, yet this is one where we feel like morally we have the right to do that to other people. And so I think that's one of the sticking points where people hear the words harm reduction and it just reflexively they're like, oh, I don't know about that. Like, I can't get on board with that idea. And like, I'm like, what about respecting people's autonomy and reducing harms to people who use drugs is problematic to you? And eventually, if you sit with them in that discomfort, a lot of people come around to be like, well, okay, you have a point. And if you keep at it, they will come around, because if they are willing to be empathic, then they will end up in this space, because that is the end conclusion of respecting other people and being empathic towards them. There is really no other option, right? It's like you either will be paternalistic and dogmatic and dictate other people's lives, or you will respect them in their own humanity and their own autonomy and acknowledge that there are consequences in life, and we can also embrace that. And so it's been really interesting to me when I do talk to people about harm reduction in general, and they're initially uncomfortable with it. And if I have the ability to sit with them multiple times and go through that step by step, in the end, they're like, well, that is very reasonable, right? That is, and some people still just can't their own, whether it's their own ego or it's the unlearning process is too uncomfortable for them. Most people, if they can embrace their own humanity and they can get over that ego part and they can get over the dogmatism, then they will recognize that that is sort of the only answer, right? Like you said, like you, Macaulay, like you said, there's like, oh, you see it from so many angles, and they're like, oh, we have this incredible solution that's just called respecting people. and we frame it as harm reduction, right? It's like,
if I could get somebody to fund me, so if any private billionaires happen to listen to this episode, like I have a goal, like this dream of teaching people how to be facilitators of dialogue, because that's also a skill that I didn't know I had until a couple of years ago. And like I've like that, like chameleon ability. I have, a bunch of different personalities that we all convene together once a week in therapy, but there has to be an ability to mold to who your audience is and what's going to connect with them.
Yep.
Even though I only grew up like 30 minutes south of Philadelphia, I grew up in an entirely different world. And, so I don't talk to legislators the same way I do parents and the same way I do doctors. When I'm engaging with parents, trust and believe I am not starting off with drug war 101, because we are not there yet. And if you can't connect with your audience, then instead of having dialogue, you're going to end up having debate, because they're instantly going to just kind of just tune out. Like, they're not going to resonate, and that's not productive. But then there is a small subset of the population where those folks, I refer to them as the let them crowd, because they are just committed to being wrong. And they're not worth engaging with. And those are the ones that, like Macaulay, I'll usually get a little petty with on LinkedIn. Like, actually, let me let you know something. But most people want to learn. They don't know what they don't know. And if nobody's going to engage with them, like, we're just going to keep chasing our tails.
Yeah. It's something that you have to be able to navigate within different cultures and different just social settings, and then kind of gauge that. And a lot of people have that ability who have been deeply traumatized and had to kind of cater to their elders' needs emotionally. And so it ends up being something that, was, something that's inherently traumatic for us in our childhood, but then ends up being like a real tool moving forward. And when we're actually trying to facilitate like legit discourse with people, and I think that a lot of it too is like, what I have to remind myself repeatedly is like, when I'm dealing with a population that I see as being marginalized and indoctrinated into subservience, I need to communicate accordingly. And, that's, where I struggle sometimes, and, to where I will be like, I can get frustrated when I'm defensive of people who use drugs and people who are being actively marginalized. That's who I care about more than anyone, and on this earth. And so it definitely, it takes a lot of self-awareness and self-care to put yourself in a position to where you can even facilitate these conversations, because they can be exhausting, but we have to kind of show up with people and kind of gauge where they're at, and then you can kind of taper your way up when it comes to the intensity of the discussion or the topics that are being laid out.
You're not the right messenger in that moment. Like,
Yeah.
I had to learn like my own biases and like be able to gauge like where I'm at internally. And so now, like, I won't hesitate to tap somebody else in. Like, I largely don't do a lot in the parent space. But that's cool, because I've got kick-ass moms that I would not want to stumble upon in a dark alley, that I tap them into those conversations, right?
Yeah.
It's like, it's not for me.
I wanted to the last thing I wanted to make sure I addressed, and Jordan, you were kind of teeing me up before my computer freaked out. Was tell me what your next step in this journey are at this point, and what are you working on? What can we plug, essentially?
So it's like I wear so many different hats, but like my passion is policy and community organizing and messaging, and that's like getting put to the test right now. We're trying to pass syringe service program legislation in Pennsylvania. I think this is actually like our year to do it, but I always remind people, like, you've got Philadelphia on one side, you've got Pittsburgh on the other side, and you've got Kentucky and the rest. And it's connecting across all these different audiences and communities, and just trying to give people a different perspective, And I tell people all the time, I think especially like in this political climate, it's really hard it's easy to feel like disenfranchised and like your voice doesn't matter. And I always tell people, like, trust me, like when you call and email like your legislators, it does matter. Like we've gotten bills pushed through. When we legalized drug trafficking in Pennsylvania 2 years ago, that went through both chambers unanimously in a year, and that's like unheard of. We've gotten good bills through, and we've gotten bad bills, blocked. But kind of like what we was saying, a few minutes ago about just creating this army of just people that can and are willing to just like create intentional dialogue, because we can pass all the laws that we want, but if we don't change the culture, like that's the actual mechanism of enforcing laws, is changing the culture. That's the focus. So like,
yeah, it's a top down approach with the like legislative advocacy, and a bottom up approach in terms of changing the culture, and the culture changes that'll increase the pressure for the legislative changes. So you kind of need to do both. I think it's awesome that you are doing both. And I really appreciate all the work that you're doing. Where can people find you?
Best ways to follow me is on LinkedIn. Jordan Scott says the Spark Collective. That's really where I just try to do my part to like change the culture, and follow what we're doing with Pennsylvania Harm Reduction Network. We're on all social media channels, and yeah, feel free to slide into my DMs. Those are actually welcome.
I appreciate that. That is where I found you, and I appreciate your voice there, certainly. Thank you so much for joining us today. I really appreciate your openness and you're talking about your journey with us today. Thanks, Macaulay. Sure. As always, signing off. We'll see you guys next time.
Views and opinions discussed on this podcast are personal and do not reflect the views or opinions of our employers. Although medical and clinical topics may be discussed in this podcast, the information provided is not medical nor clinical advice. Thank you for watching and/or listening.